Good afternoon. Thank you for joining us. We know that there's a lot of questions and a great deal of interest about vaccines. And although our case numbers remain high, the strain on our healthcare system has not abated, and the number of COVID deaths continue to climb, there is reason for optimism because we are talking about the distribution of vaccines. But as we talk about the distribution of vaccines and there's reason for optimism, there's a need for realism about the number of vaccines available, along with some of the challenges associated with getting those out. And so I think it's very important that we be very honest and very transparent about the excitement and the tremendous amount of work that's being put into doing everything we can to get them out there. But also, again, being very realistic with the public about how many are here and some of the challenges associated with ramping up vaccine distribution if and when we begin to get significant numbers. Today I'm going to walk through our efforts as a county and our plans as we roll through the rest of January and particularly heading into February for how we plan to significantly accelerate our vaccine distribution system in San Diego County, both what we as a county government will do, what our partners out there will do, along with what we can do collaboratively and working together. As a county government, we're preparing to spend up to $100 million on efforts around vaccine distribution. This is a significant investment, funds we hope to get reimbursed at some point, but we want to do whatever it takes to do everything possible to get as many vaccines in as many arms as quickly as we can. And in a minute, I'm going to walk you through what some of those plans are as it relates to pods and super stations and partnerships and other efforts. Along with some goals we have, some timelines that we hope to meet and perhaps surpass. I will also share our updated dashboard, a dashboard that we will be updating weekly, and also put in context what that information means. But throughout this, there are tremendous challenges with vaccine distribution. We are going to fight and overpower and overcome and work through and around each and every one of these obstacles. But it's vital that the public understand the situation that we're facing. We know that today there are a lot of questions that the state of California has opened up vaccines for those 65 and older. The total number of vaccines that we are aware of that have arrived in San Diego County is just north of 200,000, and we'll show that in the dashboard in a minute. But the number of San Diegans who are in Tier 1A is 620,000. It also takes 2 doses for any of those people to be fully vaccinated. And so we were just beginning the process of getting through Tier 1A with healthcare workers, and we had a long way to go based on the vaccines that were available. And then today the state announced they're opening up to 65 and older. There are approximately 500,000 San Diegans that are 65 and older. If you add those 2 categories together, you can see that that is well over 1 million people that are being told they are now eligible for a vaccine that no county in California has available to give them. And I think it is important context that we put in that we need people to be exceedingly patient, not because people aren't doing everything they can to get the vaccines out, but because the vaccines have simply not arrived in significant quantities to be able to administer to those. We expect more vaccines to arrive soon, but we don't know when, and we don't know how many, we don't know which ones. And so out of that uncertainty, we are trying to build out systems so we are ready to move swiftly as they arrive in whatever quantity they arrive, but we cannot predict. A common question is, when will I be able to get it, and I'm this age or this category, and the simple reality is we can't predict that because we cannot predict when the vaccines will arrive. As a county, we've also yet to receive a dime of funding, state or federal funding, to plan for vaccine distribution, to prepare for vaccine distribution, or to execute vaccine distribution. Now, we are not letting that hold us up. We are spending significant sums of money to ramp up our efforts and do everything possible to provide the venue for folks, but we are not waiting on those funds to arrive. We're taking a leap of faith. We're going to hold on to our receipts and hope that the reimbursements will come. But again, that can present a challenge, one that we're overcoming. And then for months, we've talked about the critical shortage of healthcare workers. There is tremendous strain on our healthcare system, our nurses, our doctors, all of those folks are incredibly overtaxed and overworked. And so when you talk about standing up mass vaccination centers throughout the county, that requires healthcare workers. And that, again, it presents a challenge, one that we are working around. We will be making some modest changes to our testing, maybe a slight dip in some of those numbers to take some of those public health nurses for vaccination sites, along with doing everything we can to get volunteers. I want to reiterate, if you are a healthcare worker who might be eligible to administer vaccines and you have some volunteer time, please go to healthcarevolunteers.ca.gov. And none of those things I just outlined is in any way an excuse, it's just the reality. And we want to set the expectation and the understanding that it's great that the state said, hey, folks 65 and older are eligible to get vaccines, but that requires counties to actually have the vaccines to be able to give to those folks. For our county run pods and our individual superstation that is up, we will at this point continue to work through healthcare workers. We hope in the near future to be able to expand that to seniors 65 and older, but we have not finished our healthcare workers, and we're going to continue to work through those. Our healthcare systems will have the ability, if they have the vaccines and they're able to administer those to those 65 and over, but I would strongly encourage the public to not have everyone immediately call your healthcare provider today, because it's highly unlikely they have sufficient quantities nor the staffing and ability to do mass vaccinations. My sense is as they are ready and have those eligible, they will be communicating with folks. And again, we will continue to do everything possible to move through this. I do want to quickly walk you through some of the plans that we have in place and share with you where we are headed and what we're trying to build out as a county to make the investment in getting this through. I know some will say it is too ambitious with too many things moving too fast, but I think it's important as a county that we set an incredibly high bar and we strive to try and meet it, and that we are willing to make that investment. A couple pieces of it, which you will see, is the concept of the vaccination superstation. The one at Petco Park has informed a lot, has shown us a lot. You do have the ability to get high numbers of folks through one site. It requires tremendous staffing and coordination and planning, but it is doable. And we plan to go from one of these to 4 of these. Our plan is in early February to open our second vaccine superstation in the South Bay area in early February. And then also in February to open similar type functions in East County and North County. We're working on locations, we're working on planning, we're working on securing all of the things that need to go into those, but we want to build out and have 4 countywide vaccine superstations that will be available to the public based on the tiering and the criteria we were in at the time. We presently have 4 smaller pods, points of distribution centers. These are placed throughout our county consistent with our Healthy Places Index, and these are also operating daily and providing vaccinations right now, again, to healthcare workers. We want to expand that from 4 to 12. Again, countywide, all of those, both superstations and pods, will be eligible to, folks can sign up for via a new portal that will be similar to the one we're using for Petco Park, but will integrate all of the various options, and we hope that that will be live in the coming weeks. In addition to that, we're going to continue to work with our partners to help them. Healthcare systems are administering vaccines on their own. We've already begun partnering with some of our healthcare systems about standing up pods at their facilities. Again, this will be higher throughput and higher volume, and we hope to do that with all of our healthcare partners. We want to work with the cities in San Diego to, again, if the city has the ability to find a site and a location, we can provide some funding and help to try and do that. And the VA, our pharmacies, which are doing skilled nursing facilities, and the Department of Defense will all continue with their efforts independent of what we are doing. Our goal is to complete 250,000 vaccinations by the end of January, and then starting February 1st to be able to administer almost 24,000 doses a day every single day, so we can reach our goal of 70% of the San Diego population age 16 and over by the end of June. But again, all of that is dependent upon the arrival of the vaccines, something that is completely and totally outside of our control. Let me walk you through a couple slides that will show graphically some of the things that we just discussed, and we will walk through these. The first one here is just a breakdown of the basic goal. You see there the San Diego County population just over 3.3 million residents. The vaccine is presently only available for those 16 and older, and so that drops us down to just under 2.7 million residents. CDC and CDPH goal is to get 70% of your county vaccinated for these folks that are eligible. So 70% of those 16 and older would be 1.882 million residents. Each of those folks need 2 shots, a first and a second dose. And so doing the math on that, starting February 1st, we would need to do 23,434 vaccines every single day, 7 days a week, for about 150 consecutive days. If we were able to do that, if the vaccines arrived, if things went according to plan, then we would complete that process by the end of June. Now, a lot can change between now and then. We're sharing with you what we know, what we think, what we're planning for, but there are a lot of variables, including many that are outside of our control. But this is guiding our efforts around the vaccine process. Now, what are all of the various methods we will use? You can see that here on the next chart, which is essentially our vaccine ecosystem. We are going to drive as best we can with what we control to make sure we meet health equity, hitting those communities hardest hit, making sure it's available to them first, accessibility and convenience. What you see here at the top is the county-hosted vaccine events. These are the 4 pods we presently have up and running, 1 in each region in the county. We want to expand that to 12 to make it more convenient, more accessible, and be able to place it in communities that need it most. The vaccine superstation sites, we have the 1 right now operating at Petco. We want to, as I mentioned, grow that to 4 different sites. The next one opening in South Bay in early February, and then East County and North County again opening those in February, and we would run those 7 days a week. Our mobile vaccination teams will be those that are going out and doing long-term care facilities, going out mobily and administering vaccines, along with some of our more rural communities, farm workers, and other places that probably wouldn't be able to get to another site. Hospital-based vaccination sites, again, our hospitals are doing their own vaccinations for folks inside their buildings, but we are working with them to build out pods. And we're willing to do that with every one of our healthcare partners in San Diego County so that they can increase the throughput and the numbers that they can do. We are also working with our clinics. Again, our clinics will have some ability to administer them on their own, and if we can help with funding, with resources, with efforts to increase that, we want to do that. City partnerships, we're working with a number of the 18 incorporated cities right now where the city might have a location. They might be able to provide a little bit of staffing help. We can provide some funds, some technical assistance, and stand up additional pods. And again, the aim on these pods is they would be accessible via a single portal, but folks have other entry points in to get it, not just restricted to that. And then, of course, the Department of Defense is receiving and administering their vaccines separate and independent from us, as is the Veterans Administration, the VA. There's a significantly large number of San Diegans who are either active duty or veteran, dependent civilian contractors, and we expect these numbers will again help us in our effort to try and achieve these goals. And then, of course, pharmacies, what they will do both in retail pharmacies and then their tasking from the federal government around skilled nursing facilities. When we look a little bit more in depth at each one of these ecosystem components, you'll see here on the next chart, you'll see again, these are just some estimates. And so this is a planning document and sharing with you what we're doing. County-hosted vaccine events, again, these are the 4 pods we have up right now. Obviously, we want to grow it to 12. You can see what we're doing today, and you can see the goal by February of 2021 if we get those up and running. We also have County Fire. We are working with them a lot on Operation Collaboration, doing vaccine events surrounding that. We think that can scale. Our superstation, you see right there, 4,000 doses a day. We think it'll be up to 5,000 doses a day by the end of the week. And again, in February, we want to expand that in early February to 2, and then adding 3 and 4, and that'll bring in a significant number of doses. Our paramedic mobile vaccination teams, again, these are going out and doing long-term care facilities, rural areas, farm workers, other places where they just won't be able to get to another site, and we don't know what those numbers will look like. We know what we're doing now, and we know that it will increase significantly. Our mobile vaccination teams. Then you see our health system and county partnerships. These are the pods we stand up in conjunction with the health system. Right now, we're doing about 1,500 a day in partnership with Rady and with Sharp, but we're in conversations with most, but not all, other healthcare systems about doing more of these. And then health system member vaccinations, this is what our health systems do on their own. And again, as we get more insight into those numbers, we will update those. Same true on federally qualified health centers. We want to partner with them. City partnerships. Other county partnerships, this is an important point to note. We're working with entities like Champions for Health, San Diego Medical Society, along with an entity known as HEAL, where once we have enough vaccines and they're set up, they will be able to go out and administer vaccines to homebound seniors, seniors who don't have the option to leave their house to go to a hospital or a pod. And so there's a number of other county partnerships that will be very targeted and focused. And then, of course, military and Veterans Affairs, the federal pharmacy program, and other pharmacies who are there. In order to make this work as best we can, understanding it's fragmented with a lot of entry points, we are looking for a clinical management system, one where the public can go, determine eligibility, appointments, notifications, and all of the information. What you see here is a screenshot of what we think this type of system would look like. We are working with the California Department of Public Health that will be rolling this out, and we will be an early adopter, a pilot project, one of the very few counties that's selected to go early, and we expect this hopefully in the coming week, that this will be up and running. I know this will alleviate tremendous anxiety by giving people the opportunity to register, assess their eligibility, and then when they are eligible, be able to schedule appointments along with getting notifications, and we hope the system will come up soon. The last chart on vaccines I want to share is just the current dashboard, and I want to make sure that we put this in some context. The 241,825 is the total doses shipped to the region that we are aware of. Again, there are some entities that get them direct from the federal government and other places, but this is what we are presently aware of. The second number there is the number of doses, again, that we are aware have been administered, but it is really important and vitally important that folks understand there is a significant lag between when a vaccine is administered and put in someone's arm and when they're able to catch up all the paperwork and upload it in the San Diego Immunization Registry. There's some times where it may be several weeks after the vaccine administered before it is uploaded into the system. And so what we know of today, based on San Diego Immunization Registry, is almost 80,000 first doses, almost 13,000 second doses, for a total of 92,305. We know the number is much higher, but again, because of that lag and that delay, it is going to take time for this to catch up. And so we will provide you the information as we get it, and we're going to do everything we can to help entities have some help and support so they can get it entered into quickly. But a lot of folks are focused on getting the vaccinations out and then catching up the paperwork component of it when they can. So again, we will continue to work through this. And then the bottom one is just the percentage of our population, 16 and older, who are fully immunized, and that gives us some sense of how far we have to go and how much work is left. Dr. McDonald and Dr. Wooten are both here, and I know there will be a lot of questions about this, and they're here to answer those questions in just a minute when we get to them. But we wanted to walk you through the situation we face along with what we're planning and where we're trying to go. Real quick, I'll run just through our regular numbers. Today, again, here you can see the last 7 days of cases. We're reporting 3,261 out of 14,000 tests performed. Pretty high percentage of positive. And again, our cases, individual days don't matter, but we still are running in that more than 3,000 range. Hospitalizations, you'll see on the next chart, again, continue to climb. 425 related ICU COVID patients, 1,804 total COVID-related hospitalizations. And again, it's modest increases, but we have not seen a decline of hospitalizations yet. And then this next chart you'll see is our ICU capacity, 425 COVID-related patients, 246 other patients. That 33 number on the top of the box there is staffed and immediately available. That includes both adult ICU and pediatric ICU beds. The state does not count the pediatric beds in their totals, but it is an ICU bed in the region, and so we want to make it available. And then the final chart here is just the deaths. Today we're reporting 54 additional COVID deaths on top of the 41 from yesterday, which brings us to 1,952. And we extend our deepest condolences to all of those families. Supervisor Vargas is going to give us an update on a couple of issues, including some recent board actions. And then we will get to your questions, and our public health doctors are here and ready to answer any questions that you may have about any aspects of COVID-19. So at this point, I'll turn it over to Supervisor Nora Vargas.
Thank you, Chair Fletcher. I think it's important to remember that we've asked a lot of you for over a year now. And believe me when I say that I know that livelihoods are on the line and that too many lives are at stake. We are committed to engaging and continuing to inform the public on the key issues that are impacting our communities. We've all been impacted by COVID, my family included. Remember, we've never been through a pandemic of this nature, but we're dedicated, and our county staff has been dedicated to ensure that we're working day in and day out for months to make sure that our resources are available to our communities, especially those vulnerable communities, and ensuring that they have access to testing and vaccines. I want to share with you that to date, we've been able to do 3,462 tests, that we were also able to distribute 47.5 in relief funding for other businesses, 13.5 million in housing relief for our residents, and 5 million for child care assistance. We continue to have programs that have made a difference for our communities, especially the Great Plates program for our seniors, disabled communities, serving 92,000 meals a day. As the chair shared, the county is building an infrastructure to ensure that we distribute these life-saving vaccines as quickly, safely, equitably, and efficiently as possible to defeat the virus. All of our county sites are neighborhood-based and placed where the greatest needs are for our communities to visit. We have made partnerships with our cities, our schools, and our CBOs. Yesterday, the Board of Supervisors supported taking more data-driven, collaborative, and equitable approach to addressing COVID-19. And this is key because in the past, not looking at healthcare through an equity lens has created disparities in our communities, from disparities in health, housing, food security, and education. Yesterday's resolution allows for our county to prioritize equity because we know there are communities that have been disproportionately impacted by this pandemic. This is a significant step because it will help ensure that any future investment that is made in our communities is based on need rather than just simply distributing funds based on population. There is a lot of work that needs to be done, specifically now where we're talking about our vaccine distribution. While we're following the guidelines from the CDC and the California Public Health, we are also know that access to healthcare is determined by zip code, and we're going to address that as we're deciding where our vaccine pots are going to be located. Taking a unified regional approach is key to all of us. Just last week, we were at Sandag as a county, making sure we were talking and prioritizing with our communities to ensure that our cities have what they need. As we're going through this process, we're trying to remain hopeful and want to make sure that you know that economic recovery is key and parallel to the distribution of this vaccine, the priority being that our communities are healthy and safe. We understand that businesses are hurting, that there's a lot of questions around school reopening, and we're keeping track of this and making sure that we're advocating at the federal and state level to ensure that this happens smoothly and safely for our communities. There's light at the end of the tunnel with these new vaccines. We're going to continue to advocate to make sure that resources are available for the county, and we're going to ask, but we do ask everyone to make sure that public health orders, they continue to follow the public health care orders, continue to use your face masks, practice physical distancing, avoid any gatherings of any type, and if you or your family have any questions, please reach out for resources at our 211. So I'm going to do it in Spanish. Buenas tardes a todos. Es muy importante comunicarles a nuestra comunidad que ahora el Condado de San Diego está haciendo todo lo posible para asegurarse que todas las personas que puedan recibir su vacuna de una segura manera y equitativa. A la misma vez quiero comunicarles que estamos navegando este proceso juntos, que estamos desarrollando un portal donde puedan inscribirse para avisarles en qué fase están ustedes y cuándo estarán las vacunas disponibles para ustedes. Es importante que nuestras comunidades sabemos que las comunidades han sido afectadas de manera desproporcionada, pero el condado tiene recursos disponibles en temas de vivienda, seguridad, alimenticia, recursos para pequeños negocios y que pueden tener acceso ahora a esos recursos por medio del número 211. Sabemos que esta administración a nivel federal va a poder tener más recursos para nuestras comunidades porque es más que ahora nunca más importante mitigar esta pandemia. En los próximos días estaremos planeando tener juntas comunitarias virtuales para informarles a nuestras comunidades acerca de las vacunas y nuestro plan de distribución. Ocupamos que las personas entiendan que sigan todavía usando sus máscaras, que estén con sus familias y que si tienen alguna información que por favor no dejen de llamar al 211. También queremos recomendarles a las personas, aquellas que sean aquellos enfermeros o profesionistas de servicios médicos, que nos acompañen por favor y pueden ir a healthcarevolunteer.ca.gov para apuntarse. Ocupamos personas que hablen el idioma español para que nos acompañen y sean voluntarios en los programas para poder dar las vacunas en nuestras comunidades. Hoy el gobierno del estado habló sobre las personas de la tercera edad, de 65 años o más, que puedan tener acceso a las vacunas. Es importante que la gente sepa que en realidad pues todavía estamos enfocados en la primera etapa y ocupamos que todas las personas que todavía tienen acceso a los medicamentos que se esperen hasta que no hablen con sus diferentes organizaciones de servicios médicos. Por ahora estamos todavía enfocados en la primera fase, que es que todos los enfermeras, las personas que tienen acceso a servicios médicos sean las personas que tengan ese acceso. Muchísimas gracias, por favor. Hay que seguir tomando las precauciones indicadas para poder, de alguna manera, seguir mejorando y ayudando a nuestras comunidades. Gracias.
Thank you, Supervisor Vargas. This time we'll go to our call-in questions.
The first call is from Brandon Stone with KUSI.
This is for you, Supervisor Fletcher. First off, congrats to you on becoming chair. Haven't had a chance to say that to you.
Thank you.
Recently, dozens of coaches from around our county, they've been meeting to discuss a safe return to play for 2021. And they've actually been asking to have an audience with you about their data, their safety protocol plans, and what you can do to help. I mean, literally, I can't go an hour on Twitter without seeing one of them in your mentions asking to respectfully meet with you. So I'm wondering, A, if you've seen their request, B, if you're willing to be a part of an online meeting with that group, and C, your plans on helping and assisting in getting our kids back on the field. Thank you.
Yeah, thank you, Brandon, for the question. And my focus right now really is on vaccine distribution, responding to the pandemic. We do meet with community groups, and we'll do my very best to meet with any group out there that has a concern, and certainly either myself or a member of a team will make sure we hear their concerns. I do think it's important, though, to put in context, we all want to get our kids back in school, and we want to get them back in school. And the best way that we can get them back in school is to have people slow the spread, lower the case count, and get the vaccines out there quickly. Football is a wonderful sport, and it's when I played, it's a fall sport, and our hope is certainly that by the fall, all of our sports are back, and we're doing what we can in order to achieve it. In terms of getting data or specific public health guidance, if you're facing third and long, that's a situation where you ought to really listen to football coaches. If you're facing a global pandemic, that is a situation where you ought to make sure you're listening to public health experts and doctors. And so I'm happy to meet with any community group out there, but if we want to get our kids back in school, we need to follow the public health orders, we need to slow the spread, we need to get people vaccinated. Next question.
This next question is from Hunter Sowards, also with KUSI.
Hi there. I promise we do have other media outlets on this call. I just got two quick ones. First, we just heard from Supervisor Vargas that we are following the CDC guidelines, but from what I just understood, 65 and older would not be prioritized along with healthcare workers right now due to eligibility or availability rather of the vaccine. So can we clarify what San Diego County has decided as far as who can get vaccinated and then why they've come to that conclusion? And then my second question is for Dr. Wooten, talking about the reason why the state is expanding. Governor Newsom, he mentioned that those 65 and older are those that are most likely to be hospitalized. So will we be reconsidering this approach as far as those super stations not being open to 65 and older, or what will that look like moving forward?
I'm going to let Dr. Wooten take both of those. 65 and over are eligible to get vaccines in San Diego. It's just a question of the availability of them and continuing to try and work through the tiers. But I'm going to let Dr. Wooten take both of those questions for you.
Thank you for the opportunity to clarify information about the prioritization. As Supervisor and Chairman Fletcher stated, if you look at the total numbers of the populations, Phase 1A, as well as Phase 1B, Tier 1, moving the 65 to 74 from Tier 2 and Phase 1B up to Tier 1, it's over 1 million individuals. What we are proposing to do locally is to glide slope into that. We know that our providers and our healthcare systems may have vaccines that they have from Phase 1A, and they have reached most of the individuals in that particular category, and now they can vaccinate their patients or their members. It doesn't mean that they won't continue to vaccinate Phase 1A, but now we can gradually move into Phase 1B, Tier 1. So again, providers and healthcare systems vaccinating their patients or member base. In regards to the superstation, eventually we will get there. We will basically see what happens as a result of this. This is the first week. And once we have the availability for individuals to sign up, as was shared by Supervisor Fletcher, then we will let the public know the when. But very soon, we will be full boarding, transitioning to 65 plus, but right now, providers that have vaccines can vaccinate their patient population. Supervisor Fletcher.
And a follow-up.
Yeah.
How do you decide who gets the primary care physicians allocated to them?
Well, CDC has guidelines in terms of the individuals with underlying medical conditions, like having a BMI that's greater than 35, diabetes, anyone with lung disease or compromised immune systems. Those are the individuals that should be priority. If someone does not have an underlying medical condition, they would be further down the list. But we want to reach those individuals 65 years of age and older that are at high risk. And if they contracted COVID-19, they would have severe complications.
Thank you, Dr. Wooten.
Thank you, Dr. Wooten. Next call in question.
Bridget Naso with NBC7.
Hi, thank you. I have a question. We have multiple reports that healthcare workers who had appointments at Petco Park today were turned away by San Diego police officers. And I understand you may be able to provide some detail today into what happened at that particular location.
Yeah, we'll have Dr. McDonald can give you an update. He may not know the specific on that, but he can give you an update.
Hi, thank you for that question. You know, our county team has been in close contact with the providers that are giving the vaccinations at the superstation, and this morning they had detected 6 cases of apparent allergic reactions in individuals who had received the vaccine, and that number clustered together was slightly higher than expected for the time period. So what they did was they slowed the vaccinations down to be able to investigate that in an abundance of caution. They switched out the lot that they were using in the possible event that it had to do with a specific lot. That slowdown led to a delay in giving vaccinations, and may be what you're referring to in terms of individuals being turned away. Again, this is the 3rd day of the vaccinations down there, ramping up to nearly 8,000 vaccinations that have been given at that site. And it was the clustering of individuals having apparent allergic reactions that in an abundance of caution, they slowed things down to be able to address. They did so, and they're back to vaccinating as we speak.
Can I have a follow-up? Can you characterize what the allergic reactions were, and were they, as you said, a cluster similar in all of the individuals that were vaccinated?
Well, those reactions are still under investigation. Whenever you're giving vaccines, especially mass vaccinations, you have contingencies in place in case individuals have any reactions. Some people get a shot and they faint. Some people have soreness at the site. Others might get hives or more significant allergic reactions. And what they did was follow their policies and procedures, and it was just the clustering of them together that led them to do I think, a great slowdown to be able to assess the situation. Again, those cases are still under investigation, and it'd be premature to comment on any greater detail than that.
Can you comment on what they did as far as the procedures so that people who might be interested in just knowing what would happen, should something happen, how it is handled with the county? How do you handle that?
Well, sure. Actually, it's any vaccination location, whether it's the COVID vaccinations or flu vaccinations at your doctor's office, should be given under medical supervision. And in this case, with a new vaccine, there are very specific guidelines that all sites that are giving these vaccinations must follow. They give information to the individuals about the vaccine. They have a standby in case of allergic reactions. In this particular case, there's EMTs and ambulances on site, so it's a rapid response. Patients are told what to look for, and if those symptoms develop, to notify the people. And then individuals are given a medical evaluation, which may involve medication to treat specific symptoms. But we actually have policies and procedures in place at all county locations where we give immunizations. And again, the ones that are being used there are the standard ones that are being used throughout the country. Hopefully that answers the question.
Thank you, Dr. McDonald. Appreciate it.
I was also just told that that site will stay open later today to make sure that all scheduled appointments for today are honored, to make sure that they can catch up with the momentary pause. Next question.
This next question is from Ashley Jacob with Fox 5.
Hi, good afternoon. So my initial question was actually already answered by Dr. Wooten. It was very similar to KUSI's question. So I was wondering if, in addition to that, could you speak to the vaccines that are currently in the county, that 200,000 that you mentioned? Is there any concern that they're staying in the freezers too long or not being administered quickly enough due to a shortage of healthcare workers able to administer them at a fast enough rate?
Well, I don't think there's a great concern. Again, when you look at the numbers that have been administered, understanding that there's a significant lag or delay when we share the number of doses that have been given, it is much higher than that. It just takes time for that information to be entered and the systems to catch up. But there are challenges in general as I walk through. There's funding challenges, there's staffing challenges, there's siting challenges. It is a complex thing. Dr. McDonald just walked through all the safety protocols and procedures that have to be put in place, and it is dependent upon healthcare workers. And to run a vaccine, you need, it's similar to when we talked about creating more healthcare. You need the structure. Well, the structure is fairly easily. You can find a parking lot or a building. You need the stuff. That is the vaccine. That's out of our control with what we get. And then you need the staffing, and that is a challenge. And so I think everyone is doing everything possible to ramp up and get as many, and we will certainly continue that. And that was really the bulk of the earlier presentation was what we're planning to do to try and significantly ramp up those numbers.
Okay, great. Thank you so much.
You.
No follow-up for
Thank
me.
you. Next question.
This question is from John Carroll with KPBS.
Hi, thank you very much, Supervisor Fletcher. If you can tell me why, after the governor has gone out and said that everyone 65 and up, those with pre-existing conditions, are now eligible to get the vaccine, how do we know what we're going to get? How does the county voice their need to the state, and how often does the state respond to those requests?
Yeah, I'll let Dr. Wooten speak. I know she's in regular communication with CDPH. I talk to the governor and Secretary Galley on a regular basis. Again, in terms of what we need around vaccines, again, the state doesn't make the vaccines. And so there's a series of aspects of things that are just out of folks' control. But there is regular communication, and I'll let Dr. Wooten talk to that because I know she talks daily to her counterparts throughout this.
Thanks, Supervisor Fletcher. As stated, we have contact with the state multiple times during the day, and I can tell you that concerns that you are bringing up were expressed by our public health officials across the state. But we recognize that there's a delicate dance here. You all and everyone keeps asking, you have X number of vaccines, why aren't more people vaccinated? And we know that we don't have enough, on the other side of the coin, we don't have enough vaccines to vaccinate everyone in the phases and tiers that have been prescribed. So our local approach is to glide slope, slowly open up. So with the state going 75 of age and older, we are doing that through our providers that have vaccines, and then as we get things in place, our infrastructure, so that we can open up the vaccinations across the spectrum of the healthcare systems and providers, and through our modalities, our pods, and our super stations, we have to plan for that process. So we will be conducting the planning process beyond providers over the next 10 days, and then we will move into 65 and older at the end of the month, because the next group that we have to move to are the top three, or the next three essential workers, which includes healthcare and schools or educators, as well as emergency services, and then food and agriculture, including restaurants. So we will be planning for those latter three essential services to hopefully begin vaccinating them in early February. Thank you.
Thank you, Doctor. Thank you, Supervisor.
Thank you. Next question.
This question is from Todd Strain with NBC7.
This question is for Nathan Fletcher. And Nathan, it's a follow-up to the question earlier about high school athletics. Your response on the vaccine, I understand, but with regards to the Let Them Play Foundation, one of their big qualms is that as of now, until the vaccine rollout is completed, people are going out of state. Tens and thousands of San Diego, California kids are going out of state to compete, then returning. They're also playing in illegal tournaments throughout the state. So what's being done now is not working. They contend they have a safe way to return to play, backed by health data, and are frustrated because they cannot talk to local or state politicians. So I guess my question is, while we wait for the vaccine, why not engage in some discussions for some other alternatives that maybe can curb the problem?
Well, as I said earlier, I'm happy to meet with folks and listen to their concerns, but again, these decisions are set at the state level, and there's been a robust debate and discussion around getting kids back in schools. And I think we all want to get our kids back in school. And we all want our kids, when they get back in school, to be able to get back into sports. And so, whether it's getting restaurants open or gyms to indoor or barber shops, there's a lot of things that we all want to get back and have be a part of our life. But when you look at the daily number of cases, at the impact on the hospital system, and the need to get the vaccine, we really have to confront what's in front of us. And we have a path out of this, and we have a path for how it can get better. But we have to have those efforts that are slowing the spread, that are alleviating pressure on the healthcare and getting the vaccines. And that really is our best path forward, particularly in the situation with where we are now. But, again, I know the county does countless stakeholder meetings and outreach meetings, and we meet with lots of groups, those who are happy, those that are upset, all the same. But again, the rules around those activities are going to be set by the state of California, but we're happy to listen to folks, hear their concerns. But we have to slow the spread, and we have to get vaccines out there, and there's no avoiding that reality.
Thank you.
Thank you.
Next question is from Elliot Spagat with the Associated Press.
Thank you, and forgive me if I'm being a little slow in understanding this, but these numbers were striking to me. That you said that only about, close to 250,000 doses have arrived in San Diego, and to meet Tier 1, you're going to need at least 1.2 million, 600,000 plus doses. Yet the state is already moving on to this advanced, next tier. So if I'm understanding that correctly, people who are, perfectly healthy, 66 years old, not in healthcare, outside of San Diego County, they are getting it ahead of people in San Diego County who are in that higher tier. Am I understanding it correctly? I know, Supervisor Fletcher, you said there's a reporting lag. Would that, would that explain the whole difference? Are there like hundreds of thousands more doses out there that we don't know about? Could you kind of clarify that?
Yeah, Elliot, the reporting lag I was referencing was more related to the number of doses that have been administered. So if you look at that chart, and we'll share it with you, but the 92,305 is the total doses that we know have been administered. Some first dose and then some second dose. There's a lag in that number catching up. The 241,000 is total doses shipped to the region. Now there could be more because we don't know how many DoD got. We don't know how many VA got. There are some things out there that we don't know. But the 241 is probably a more accurate representation than the 92,000 because again, 92,000 administered has a significant delay. But your basic point is right, in that it is a challenge, and we want to just be really clear with the people of San Diego in a very candid and transparent way that we don't have enough vaccines to do everyone in Tier 1A, much less everyone who's 65 and older in Tier 1B. And again, Tier 1A, you're spot on, 620,000 San Diegans, which would mean you would need double that amount in order to fully vaccinate them, and then close to 500,000 65 and older, which means you would need double that amount. So we just don't want to create an expectation that suddenly everyone 65 and older is just going to roll in and get the vaccine. That's just simply not a reality with what has been allocated and shipped to the county. So health systems right now have the ability, if they are able to vaccinate those 65 and older. We're going to continue with the efforts we're doing and what we're doing with our partners to continue to plow through that 1A section, and we hope to get to 65 and older as soon as possible. We hope to get to everyone as soon as possible, but we can only administer vaccines we actually have.
And that doesn't upset you, though, that people in other parts of the state they're much further along. They're in Tier 1B, and we're still stuck. San Diego's still, quite a bit of ways from finishing 1A.
Well, there's a lot of things about COVID that upset me and frustrate me, but I think every county is having a shortage of the number of vaccines that they want, along with the challenges of getting them out. I'm not aware of any county that has progressed all the way through 1A. I don't think. Okay. Dr. Wooten, are you? No, Dr. Wooten's shaking her head. She's not aware of any county that's made it all the way through 1A either. So, some may choose to move into another tier first, but it is, I just think it's important. We wanted to be very clear about the context around that announcement and what it means and what it doesn't mean.
Okay. And if I could just super quickly, where are these vaccines coming from? Are they from which state agencies or federal agencies?
CDPH, California Department of Public Health.
Okay.
Yeah.
And lastly, we're hearing anecdotal reports that some people are not showing up for their appointments, and the vaccines get spoiled basically, so they have to give them to basically whoever's there, even if they're not in the tiered order. Is that happening?
Yeah, I'm going to let Dr. McDonald address that. He can talk to you about any excess that's there. I will tell you in general, we have the opposite problem of we have significantly more people who want appointments than we have appointments available. And that's a problem, but that is a good problem. But I'll let Dr. McDonald walk through what they may do at the end of the day.
Yeah, again, thank you for these questions, because I think it really is on everyone's mind as we're trying to work through this system. I'm in regular contact, as Dr. Wooten is, with our counterparts in other counties, and I can tell you that all the other counties in Southern California and really the majority of large counties are in the same boat. They are working actively on 1A, and I would interpret this expansion of eligibility to be able to, again, give local flexibility for the situation you just described. Let's say that there is, at the end of a day, some vaccine that may expire relatively quickly, and they need to reach out to another eligible group. Well, that eligible group has now been highlighted for us by the governor. So I think that, again, that's how I would interpret this widening of eligibility, is just being a little bit more flexible when there are those kinds of decisions that need to be made within systems to be able to address that. So that doesn't really come up that often, to be honest with you, although they perhaps make headlines when they have some doses. In fact, our providers are doing a great job of husbanding those resources, and in fact, sometimes getting even more doses out of the multi-dose vials because of the excesses that may be in the vials to be able to vaccinate more people than they have actually been given doses for. So those are all things that are important operational considerations. And again, hopefully that answers your question.
Yeah, thank you.
Elliot, just one point of clarification so I'm clear. The vaccines are not physically shipped from CDPH. CDPH controls the allocation, so they determine which one goes where, but they're physically shipped to whoever gets them directly from the manufacturer. But again, it's through their process, the CDPH process.
Okay. And then you have additional through VA.
That's right. That's right. And we don't, Elliot, and this is an important point too we made earlier, we don't have great insight yet. VA, our VA partners in San Diego County are wonderful, and we expect to be able to get their numbers, certainly doses administered soon. DOD, again, we're working with them. When you look at the massive number of San Diegans who are active duty or dependents or veteran, it's a pretty large percentage of the total, and so we're working again to try and be able to at least get the aggregate numbers so that we can add those into what we share.
Thank you.
Yep. Next question.
This question is from Paul Sasson with the San Diego Union Tribune.
Thank you. I just wanted to make sure we all understand how our local public health guidance on the 65 plus change is kind of different or the same as what CDPH said today or what the CDC said yesterday. I'm looking at the CDPH announcement here on my screen. It says pretty much everybody over 65 and older is now eligible. I think what Dr. Wooten said was, we are conserving our county supply that comes directly to the county to continue with 1A healthcare worker vaccination in our sites. Those outside of the county supply, those who have received directly supply from the CDC or whoever, can do anyone 65 and older as of today. But then there was also something said, comorbid conditions, people with compromised immune systems and other things. So is the county saying those outside of the county supply are only able to do 65 and over if they have a comorbid condition, or are you just kind of leaving it up to each health provider to make that decision individually?
So Paul, what we said was, so if you break it down and start vaccinating 65 years of age and older, you have some 65 years and older in that age group. You have some who have underlying medical conditions, the ones that put you at greater risk. So there has to be, because there's almost 500,000 of individuals 65 years of age and older. So you have to prioritize. And then you have to prioritize because we don't have 5,000 vaccines for just that age group. So as the state stated today, counties can begin offering. Well, you can't just open the gate and start vaccinating people. You have to plan. So we are working with the state's Accenture platform so that people can register. So we will be developing the process so people can register over the next 10 days so that we can begin opening up across all sectors and points of access for 65 years of age and older the week of the 25th. In the meantime, however, those providers that have vaccines and they have offered it to all of the individuals in the phase 1A, because keep in mind, we can't make anybody get vaccinated. So if people decline, then the different healthcare systems will have vaccines. So then they can begin offering those vaccines that they have available to their patient population. So that's what we are recommending. And then we will glide slope into vaccinating at the super stations and our other pods for 65 years of age and older. But the infrastructure is it has to be in place along with the stuff and the staffing. Thank you.
So, Dr. Wooten, just to follow up, so just to be clear, I'm just trying to make sure we have this straight. health systems that have leftover supply after 1A can vaccinate anybody 65 and older. They don't have to have a comorbid condition.
They can, within their system, Paul, because they don't have vaccines for all of their 65 years of age and older, they will want to look at those that are at highest risk first. We're asking them to do that. So that's what we're asking them to do.
Prioritize.
Because, again, supply, we don't have 500,000 vaccines for the population that's 65 years of age and older. So trying to get it to those that are at greatest risk is the rationale that's the approach that we are taking.
Thank you.
Does that explain?
Yes, thank you.
Oh, thank you.
Thank you. I think that's all of our call-in questions. We'll go to our text questions.
This first text question is from Abby Alford with Channel News 8. She had follow-up questions about the vaccinations. Is it safe to drive yourself to get a vaccine? And is the county using the CDC vSafe check-in app to monitor?
Dr. McDonald will address this.
Sure. Thank you for that question. Again, most of the individuals who are being vaccinated at the site at Petco are in fact driving. Some, in fact, are being vaccinated at a pedestrian station there, so I just want to make sure that that option is known. If you are somebody who gets shots and does well and has never fainted before and feels, again, comfortable, no history of allergic reactions, it is safe to drive yourself. But be aware that there is a very small risk that an adverse reaction may occur. So if you have the option of having somebody go with you, that's not a bad one. That person can observe or drive for you. That would be perfectly safe. The vSafe app is actually a CDC-run application, and we in San Diego, and individuals download that onto their individual phones, and we at the county don't have the visibility to know how many San Diegans have downloaded that app. We've actually asked that question up the chain and haven't got the answer on it. It is a mechanism for individuals to record any reactions that they might have, and it's a way that CDC is actively collecting information on people who have vaccines. That's different, though, than any vaccines that may occur at the site. It's important to know that will have a specific report filed to the FDA called a VAERS report. It's a Vaccine Adverse Event Response System report, a VAERS report, and those will be filed on the ones that occurred recently. But going back to the original question, again, most people have had shots before. They know how they react, and any question about it, you should probably have somebody drive you.
Go to our next text question.
iNewsSource. New CDC data shows San Diego County has the fourth most COVID cases and death out of all U.S. counties in the past week. Epidemiologists say one of the reasons for this is the lack of enforcement by government officials of the public health orders designed to keep the virus under control. What is your response to that?
Well, I think if you're comparing week by week, we're certainly at the most challenging point of the entire pandemic is where we are right now. And so week by week, I think California is certainly facing its most difficult stretch. But, you know, my sense is even if you looked at total based on the entire pandemic, given we're the fifth largest county by population, that we would be, you know, somewhere in that top ranking as well. I think it's important to take into account how many tests have been done. Are you looking at an individual week or total? But enforcement has been a challenge. It's been a challenge we've been talking about for 7-8 months now. And as a county, we are doing everything we can within our power as a county public health agency, which is the inspections, the education, the cease and desist orders. And then obviously beyond that, it requires law enforcement's effort to do the citations, and we appreciate their recent efforts to participate more. We appreciate actions by the city of San Diego to do more. But it is a challenge, and it's a very difficult situation and one we're going to continue to do. I also think it's important to put in context the situation in San Diego, which is very challenging and not good, versus our surrounding counties, where, again, San Diegans continue to do better. So a lot of challenges and a lot of things we have to continue to work on, but we just have to continue to push ahead and make adjustments where we can.
question is for Supervisor Vargas from Nelly Cervantes with El Imparcial Tijuana. She asks, Supervisor Vargas mentioned 3 million tests have been done, which could be interpreted as if almost all the population of the county was already tested. Is there any specific information that indicates if it was 3 million people in total who had the test done, or if the number of people like teachers or first responders who have gotten tested several times to make up those numbers?
Thank you for that question. I think the clarification is that this is the cumulative test. It goes back to March and April when the county actually started this effort. It includes nursing homes, it includes county hospitals, clinics, and commercial labs, and all professionals, so not specific to one group. But it's important to share this because I think as we're thinking about the infrastructure that we're building for the vaccine, in unity and partnership, we have been able to distribute over 3 million tests. And so this has served as the foundation for the work that we're going to be doing as we're distributing the vaccines for our communities as well.
Supervisor Vargas, this next question is asking to have you respond in Spanish. This question is from Claudia Bucchio with Univision San Diego. She's asking several questions. The first one is, there's much fear and misinformation among the Latino community regarding COVID-19 vaccines, but why is it important for Latinos over 65 to get vaccinated?
Muchas gracias por la pregunta. La pregunta es sobre... Espera un momento. La pregunta es sobre las comunidades latinas y por qué es importante que las personas de 65 años o más obtengan la vacuna de COVID, ¿verdad? Pues más que nada porque las personas de la tercera edad están a riesgo y es muy importante para nosotros comunicar con nuestras comunidades que esta vacuna es efectiva, que esta vacuna es importante. Son 2 vacunas las que les van a dar a las comunidades. Primero les van a dar una y como a las cuantas semanas, creo que casi 20 días, van a tener la segunda parte de la vacuna. Entonces, como son comunidades que están más a riesgo, es importante que las personas sepan que es una vacuna que les va a poder ayudar a prevenir la enfermedad del COVID.
The second question she asked is, how will the county work with the community to get Latinos vaccinated?
Pues ahorita nos encontramos... La pregunta es de que cómo vamos a trabajar con las comunidades latinas. Este no es un proyecto que se empieza ahora, sino que es un proyecto que hemos estado haciendo en los últimos meses. Organizaciones como el Latino Health Coalition, que está trabajando con nosotros, el Chicano Federation, San Isidro Health Center, otras organizaciones y clínicas del condado están trabajando con nosotros y apoyando este trabajo. Más que nada, es trabajo de comunidad con nuestros regidores, con nuestros alcaldes en el condado y en el estado, para poder estar informando a las comunidades, ya sea en el idioma español, en las iglesias, vamos a estar no solamente por medios de redes sociales, pero también radio y televisión, para que la gente sepa a dónde puede ir. Lo importante ahorita es que la gente sepa que estamos todavía en la primera fase, ¿no? Entonces ahorita es cuando todavía las personas que están en los trabajos de salud pública, que son las primeras personas, aunque ahora escucharon todos ustedes que el gobernador hablaba de que las personas de 65 años o más pueden tener acceso a estas vacunas. Por ahora, solamente que su proveedor médico les hable y les diga que tengan que ir por esa vacuna, todavía tengan un poquito de paciencia. A ustedes todavía no les va a tocar hasta que el condado va a poder darles información cuando estemos listos para que las personas de 65 años o más puedan tener acceso a esas vacunas. Pero por ahora, la primera etapa es con el 1A que le llaman, que son todas las personas que están trabajando en los sistemas de salud pública y todo lo que es medicina en general.
And the last question Claudia asked is, will immigration status play a role in vaccine eligibility?
Absolutamente no. La pregunta es que si van a preguntar su estatus legal. El condado de San Diego está comprometido a que todas las personas tengan acceso a salud pública, inclusive en cuanto a las vacunas. Así que no se les va a pedir ningún documento en cuanto a su estatus legal en el estado. Lo que sí queremos es que tienen su información. Es que la información es confidencial y es privada porque queremos que sepan ustedes que se les va a poder hablar para recordarles que tienen que ya regresar por su segunda vacuna. Así que estamos comprometidos para que toda la información sea confidencial y privada para todas las personas. Gracias.
Thank you. That concludes our briefing for today. I want to point out next week we will be joining you on Thursday, the 21st at 2:30 p.m. instead of Wednesday, and we will continue to provide regular updates as needed between now and then. Thank you all.